Hello and a very warm welcome to you all. I am Vikas Nangia with Focus Live Season 2. Ladies and gentlemen, the number of COVID-19 patients in United States of America continues to surge. We at TV Asia, through our various programs such as Focus Live and Community Roundup, continue to do our community outreach effort by educating you, empowering you, by keeping you informed about the complexities, implications, symptoms, precautions that you should be taking during the time of crisis. Tonight on the program, we talk to yet another expert and on a very, very significant topic, that is coronavirus and your heart. It is important for us to understand, yet again, many of our community members are heart patients. It is important for us to understand that what precautions and symptoms we should be taking specifically for individuals who are suffering from cardiovascular disease. आपको ये बताते हुए बड़ी उत्सुकता भी है, प्रसन्नता भी है कि एक और जो आज के हमारे मेहमान हैं, उनकी रिसर्च डॉक्यूमेंट्स के हिसाब से ये भी पता चल रहा है कि कोरोना वायरस के चलते कम तादाद हो रही है हार्ट पेशेंट्स को हार्ट अटैक कम हो रहे हैं या आम इंसान को हार्ट अटैक कम हो रहे हैं। लेकिन दूसरी बात जो चिंताजनक ये भी है कि बहुत से लोग जो अंडरलाइंग हेल्थ कंडीशन में है, जिनको डायबिटीज है, जिनको लंग्स इश्यूज हैं, जिनको डायलिसिस पे हैं और जिनको ऑलरेडी एग्जिस्टिंग हार्ट कंडीशंस हैं, उनमें जो है अधिकांश जो लोग जिनको जागरूक रहने की जरूरत है, सतर्क रहने की जरूरत है, वो हार्ट पेशेंट्स ही हैं. Ladies and gentlemen, to get more insight and to get the expertise from our guest, let me tell you, our guest tonight on the program is one of the finest interventional cardiovascular surgeon here in the country. We have with us Dr. Samin Sharma, who's the head at the Mount Sinai Heart, New York. Dr. Sharma, thank you so much for joining us here on Focus Live.
Thank you, Vikasji, and thank you, TV Asia, to give this perspective. And I've been watching a lot of TV Asia news and these focus interviews where you have highlighted various aspects of coronavirus and COVID-19. What I'm going to discuss today is in a positive way that how this has helped in terms of shaping up from the heart point of view. As you mentioned, I want to put one point in a smaller way and the second point of the heart manifestation in the more broader term. One thing for sure, what we learned, that coronavirus affects basically patients older age, those who have heart problem already. Then third factor is those who have lung problems, respiratory with asthma, emphysema, recurrent pneumonias and so. And then comes your diabetes. And fourth factor, the big factor has been obesity, high BMI. So those are the four actually, and then male preponderance compared to women, but those are the various factors. So clearly, heart patient is more susceptible to complications of coronavirus, leading to hospital admission, intubation, and other complications. So that actually has been well known, and we are telling our heart patient to exert extra precaution so that to avoid the contact, take use the mask all the time, and isolations and quarantine. Those all factors have been teaching. So that actually is the well-known fact in which we need to continue to emphasize, and maybe we'll come back towards the end of our discussion that how those heart patients should take care. More important, what we have noticed, and this is a very revolutionary, remarkable, which nobody thought. Why? Because when you have a lung problem like influenza epidemic, we have more heart attacks. So studies actually, the epidemiological studies have shown that once you have lung issues, you have more heart attacks. Only in last 6 weeks, this is again very recent, in last 6 weeks, most of the hospital emergency rooms, not only in Mount Sinai, not only in New York, other part of United States, and globally, whether it's India, it's China. China, again, question with the report, they are more concentrating on the virus, their publication. But Spain and Italy, the incidence of heart attack, which we call STEMI, ST segment elevation MI, or STEMI, or call for 911, that is for emergency of somebody having a heart attack, has significantly reduced from 30 to 70%. You say, wow, How that happened? This is unusual because that's what nobody expected. But clearly, the various factors goes down to, and actually I have kind of put the four factors. Should I elaborate one by one them?
You know what? I would get into request you to elaborate and articulate that in a moment from now. But very importantly, in the beginning, since you mentioned about influenza, I wanted to ask you: has there been a pattern of these pandemics that we've been seeing in the last few years? About SARS and MERS and so much more happening. So, is there a pattern that we are seeing, and in times to come, in coming times, should we be expecting more of these? And is this the new normal?
I mean, it actually, this corona pandemic COVID-19 has really taught us a lot.
Mhm.
Taught in the sense that simple, no, we knew that Spanish flu back in the 1900 and 1908 and 10 really uh, spread worldwide pandemic. And even that, if you take the pictures of, they show even that time the governors and mayors put the restriction of not meeting more than 10 people, use of mask. And so this seems to be that we felt that we are not going to get any pandemic. I would say the COVID-19 has told us that we, no matter what discovery we do, no matter how advanced we become, the pandemics are likely to happen. We know, as you mentioned, that with the SARS, with Ebola, they were all contained. They were small and the small areas. But if the virus is virulent and easily spreadable, like the current corona COVID-19 virus, this actually has taken the global shape, which has really altered our life. And I can tell you that our life will never be the same what it was at beginning of the year. It will maybe, whether will it recover to this stage what we were earlier part of the year, but it's, if I had to guess, will never be the same. It really has affected. So what does that mean? As you mentioned, that should we be worried as a person, as a public, as a healthcare worker, or as the from the government agencies at the country level for the pandemic? I would say that corona epidemic or pandemic has really taught us that we need to be prepared for these kind of attacks in the future also.
Allow me to take some video questions that we've received for tonight's broadcast of Focus Live with you as a featured guest. The first question that I have for you is from Monica Mahajan from New Jersey. Take a listen.
Hi, this is Monica. My question is that a larger portion of our South Asian community is at some risk of heart disease. So during these times, what are the special precautions that we should all be taking? Of course, I mean social distancing, but apart from that, what else should we be worrying about? Thank you.
Two things, Monica ji, the right question. One, what heart patient should take a precaution? As I mentioned earlier, heart patients are especially prone to develop the coronavirus. More importantly, complications of coronavirus. What is the because the virus, like any other disease, in various stages. So one, having a simple fever and cough. Second, you start developing shortness of breath and some pneumonia. Third, you cannot oxygenate at home, so to get oxygen you need to be admitted. And fourth, then of course cannot breathe on your own. You have to put in a tube which is called intubation. So all those stages. So what has shown that age and established coronary artery disease already has really put the patients at much risk. So heart patients are especially prone, and that actually has led to the telehealth visits. So just to give an example, I used to see 40 patients 3 times a week. Now I'm doing teleconsultation in 10 to 12 patients, and only 1 or 2 are coming to see patient here physically. Why? Because why to expose these heart patients? And no matter what precautions you try to do, but if there is a virus which is in the air, which we're learning more and more, it's just not the contact. Small droplets may still stay in the air for a significant period of time. So don't expose them. So clearly, heart patients have to take special precautions. The second is, of course, if you get some symptoms, and that is the most important point. So a lot of people are worried about going to the hospital because of corona exposure. But at the same time, if they need the help, and we also know that all the hospitals have been asked not to take care of elective cases. You understand? But at the same time, if a heart patient is suffering from increasing symptoms, having chest pain, having shortness of breath, so what clear advice is, those should get to the medical help.
And why only seniors these days? Because we hear even individuals in their 30s and 40s are having heart attacks, and their immunity is down as well, because many of them are in anxiety, depression. There's so much going on simultaneously, and all these things, as much as COVID-19 is there on one hand, the other hand, it leads to failure of heart as well. So explain us the implications and sensitivity, which is very important for our viewers to understand.
Yeah. So your appropriate point, that why the old people and why this virus is kind of sparing the younger. Although we have cases, even the infant, but young age, but kind of very low. So it seems to be that it's a natural process of aging. One, your immunity goes down, but more importantly, that with age, the lung power, ability to breathe in a normal, we call tidal volume. Somebody has to blow in a machine, and usual tidal volume, let's say 600, 700 cc. So with age, that decreases. So it seems to be that this age phenomena is related to your decreasing power in the lungs. So basically, when virus gets into the respiratory tract through nose or throat, it just lines it up. And since you're already predisposed because of slightly decreased lung function, although you're normal otherwise, there's no lung problem, but because of age, normal process, lower immunity, both of them. So lung as well as lower immunity contribute to higher incidence of the virus, COVID virus in the elderly. And it seems to be, as you mentioned, that how sensitive it is. We have biggest data from China, and they showed the linear relationships. Usually it starts about like age of 50, from 50s, and peaks at 80, 85. So clearly you can see a rising correlation with age and the incidence of coronavirus, and also at the same time, the complications. The complications also occur higher in the age group, and those are the two complications we say. One, requiring the ventilator, and the second, developing a heart problem. So those both are the cardiovascular complications are dependent on age infected coronavirus patients.
Yeah. दर्शकों, फोकस लाइव में अब वक्त तो चला है एक छोटे से ब्रेक का। ब्रेक के बाद डॉक्टर समीन शर्मा जी के साथ बातचीत जारी रहेगी। ब्रेक के बाद एक और आपके काफी सारे वीडियो क्वेश्चंस लेंगे। मुझे मालूम है कि आप में से बहुत से लोग इस वक्त जिज्ञासु हैं, जानना चाहते हैं, खासतौर पे हमारे सीनियर्स जो हैं वो जानना चाहते हैं कि उनको अपनी सेहत के लिए क्या-क्या प्रिकॉशंस लेने चाहिए। और दूसरा, जो डॉक्टर शर्मा का रिसर्च डॉक्यूमेंट है, जो पहलू उनके सामने जो उन्होंने रखे, जो कुछ सिग्निफिकेंट पॉइंट्स उन्होंने की ऑब्जर्वेशन के हैं, उन पर बातचीत होगी। We'll be right back after these messages. Stay tuned and keep watching Focus Live Season 2. Welcome back. आप देख रहे हैं Focus Live Season 2. Ladies and gentlemen, tonight on the program, we are talking to Dr. Samin Sharma. He's the Senior Vice President, Operation and Quality at Mount Sinai Heart in New York. And specifically tonight, we are talking to him about coronavirus and your heart. Dr. Sharma, thanks so much for joining us here on Focus Live. And thank you so much for sharing your expertise and knowledge with our viewers, which is very, very significant at this point of time. Without any further ado, I want you to really explain us about the research document that you have put together, and walk us through some good news that you shared in the beginning.
Yeah. So actually, we always say there is for any process there is a good side and bad side. Bad side everybody knows about the COVID-19, but what is the good side of it? Well, it's I would say indirect benefit. And what it is in our community, this actually question started coming up in last just about very recent, in 2 weeks, while many of us shared that heart attack disappeared and this was unanimous globally. multiple investigators, and knowing that I here as well as my hospital back in Jaipur ESCC. And then I contacted many other cardiologists who are on the battlefield and their hospital experience and so. And one thing unanimously came, and that is that the call for 911 and patient developing the heart attack, which we call STEMI, ST segment elevation MI, which is life-threatening, has significantly declined from 30 to 70 or 80%. You say,
Wow.
wow. So at least, actually, this came in the right time. Why? Because this way, you're less heart patient. Every hospital is right now groping with the problem to accommodate the coronavirus patients, getting them into ICU. ICU beds are not available. And therefore, if a cardiac patient comes and require ICU, is really troublesome. So this actually is coming in a good way in the right time. Now, coming back to the point that why this is happening. So I, based on our medical knowledge, based on many numerous published data, come up with the 4 possible explanations. The most important, which I have put together, is the improved physical and mental health. You say, what does that mean? Well, very simple. In the past, I'm always thinking, what am I going to do today? I have so many things to do that you have to call, make this person, this meeting, the mental stress. And what has happened now? That mental stress is gone. There's no stress of the job because majority of people are working from home, or the negative point of this I'll just discuss a little shortly. But key is our mental stress has significantly eliminated for short term. That is what I want to say. Short term, because long term might have a little different implication. So less stress. Second, your physical well-being. What we are doing now, staying at home, doing more yoga, more exercise, and so clearly more prayers. So kind of both mental and physical relaxation. Now, there is a downside. Downside of this is that can it give rise to more stress in the future? Yes, and that's where we still need to wait and see. Point is, if you are staying more home because of this, once in the post-COVID era, a lot of people will be fired. They will be out of job. There will be a lot of depression, and therefore maybe even suicide. So this may, if continues on a long run, may come negative. But as far as what we have at present, let's enjoy and continue to do our physical and mental health. And that's really directly correlated with decreased heart attack and STEMI and the heart attack. Second, the home cooked meal clearly is one of the contributing factor for better heart health. Also at the same time, that we are not doing those binges, the heavy drinking and eating and smoking. All those things have disappeared. No parties. So you're not eating too much because it's normal in the past that you have some group gathering, you drink, people drink, and those who smoke, they smoke and eat quite a bit. So that part has gone. So that's totally disappeared. So that is also the very important factor. And this actually, in my opinion, hope this factor of the diet contributing to overall a better outcome of the heart patient should continue even in the post-COVID era. Now, also at the same time, since you are at home, you're taking your diet, taking care of your food, also you're taking all the medications. So medicine compliance. So you're fluctuating blood pressure because you miss your medicines or you missed your heart medicine, you start having some angina. Now every patient from the heart point of view has all the time to take the medicines in a regular time. So there's no issues in medication compliance is also a very contributing factor. The third factor, which I feel that of these 3 is the top, and that is decreased pollution. Now we say, what does that mean? Because we all learned that even, let's say, take the example of India. Delhi, Bombay, highest pollution, which we call the particulate matter with the 25 parts, and those higher incidence of those particulate matter in the air associated with bad outcome of both heart as well as lungs. So this actually, numerous environmental studies have shown that higher particulate matter is higher the chance of heart problem as well as lung problems, attack as well as even stroke also. Why this is a global phenomena? Knowing that global phenomena, heart attack has significantly reduced, the air pollution and nitrogen oxide are, to me, of the 3 points which I have described, are probably puts on the top. Although the others contribute, but I think the air pollution will be on the top, and with this, hopefully, we'll learn quite a bit from it. The fourth factor, which everybody is speculative, is that maybe patients are dying at home and not coming to the hospital.
Yes.
And that's a real concern. And that actually, if it's happening, it's a very bad. And therefore, as my message was earlier, that if you're having a increase in your symptoms, your heart problem, do not wait home. But yes, what is the contribution of this factor? I cannot say for 100% at present, but it probably contribute maybe 5% of, or maybe less than 10% of a decrease in heart attack. But if I had to give the number, I would put 50% reduction by the air pollution, and which is contributing to lower heart attack. Then I would say that good, our mental and physical health contributing to 30%. The better eating is 20-25%, and about 5 to 10% would be that patients are dying at home with the heart attack and not coming to the hospital.
Dr. Sharma, all the percentages that you gave and all the points that you made, the research is very apt and very pertinent, and it's self-explanatory, and many of them will be resonating with the points that you have put together, and it's a great observation. So thanks so much for sharing that report and study with us. Allow me to take some more video questions in this segment. I'll take a video question from Geeta Mehrotra. Take a look at it.
Dr. Sharma, thank you for taking my call. A blessing in disguise that we find out that the heart attack rate has reduced during this pandemic. This will also open up a total different door for the health industries to look at diseases in a new perspective. Even though the stress level, general stress level of the world and the fear around the world is high, but personal slowing down of the pace has helped people to look within themselves. Would this be a major indicator to look at health in a total different way? Because in the past it was the cholesterol is the problem, and now we hear cholesterol is not the problem. So can you please shed light on this?
Geeta, your question basically was, which points out to the point I'm making, is the blessing in disguise.
Right.
And how much this blessing in disguise really contributing to this health of patients at present. I would say for the short term, there's no question it is very helpful. That is lower mental stress at present and good home cooked meal. Now, both of them, long term, if we are not careful, will work against us. One, the mental stress, if you are unemployed and your salary is cut, your work is less in the post-COVID era, of course, it may lead to depression and may create other cardiovascular, because you'll get then more stress and may create more heart problems. So that's maybe a long term. The second is the same, the food. If you overdo while you're staying home and not exercising, not taking care of yourself, you may gain weight. And those are various cartoons we have seen on WhatsApp that gaining weight because you are staying at home. But need to be careful. So just balance. So both, I would say the blessing in disguise is there for at present to take care of ourselves, but more importantly, change our habit. So even when the COVID era ends, those habits should continue. Taking care of mental and physical health and exercise and good food, that will lead to our newer society post-COVID with suffering from lower heart disease, less heart attacks, and better healthy and lifestyle.
what's the protocol like? I mean, when a patient visits you in person, your team of your staff usually checks their vitals, checks their blood pressure, all those things which are prerequisites that gives you the reading to assess the patient. Now, all that is not happening when the patient is calling you from home. So what are the parameters? Just walk us through, how do you assess the health condition of the person when a patient is calling from home?
That's a very important point, Vikashji. This is really, you're putting it right, the at the crux of this telemedicine. The good news is that patient can communicate with the doctor, but lot of bad news. One, you cannot take any blood test, you cannot do the electrocardiogram, and many other testings which we do when we see the patient, like doing the echocardiogram, and so those are not done. The purpose of the telemedicine is that you are connected to the patient. That's it. Simple. Advantage of the telemedicine, whether video visit or just the telephone, is that patient is connected. So therefore, when you hear those signals that, you know what, I'm patient complaining that having shortness of breath, I took 2 nitroglycerin, and now you see on the, at least if you see on the TV with a video visit, patients, the symptoms of patients, they drown, little pale. So you say, you know what, you need to come to the hospital, but avoid the emergency room. So whole purpose, this televisit and telemedicine has really helped us to be connected with the patient. So now, rather than everybody coming, every patient is coming, you're calling only selected patients. So
it's been filtered basically.
Yeah, the filtered basically, but at the same time, giving confidence to the patient that I'm connected with my doctor.
Yeah, and that's a big moral boost, that you've not lost the connection. You're virtually, you might not be socially connected because we're all socially distancing, but you're virtually connected, and these FaceTime and the way we are interacting and video conferencing, at least you're connected with your doctor, and that is very, very important. Ladies and gentlemen, it's time for us to take another short commercial break. On the other side of the break, with a promise, as I said in the beginning, in the second part of the program, we'll be taking many more of your video questions. Stay tuned and keep watching Focus Live Season 2. Welcome back. You're watching Focus Live Season 2. I am Vikas Nangia. Ladies and gentlemen, tonight we are in conversation with Dr. Samin Sharma, Senior Vice President, Operation and Quality at Mount Sinai Heart in New York City. Our topic for tonight's conversation is coronavirus and your heart, something very significant that individuals with underlying health condition, the precautions that they should be taking, and Dr. Sharma is guiding us, sharing his expertise with our viewers. Dr. Sharma, once again, welcome to Focus Live. Thanks so much for being part of the conversation. Allow me to take some video questions back to back. This video question we have is from Dr. Asha Parikh from Atlanta, Georgia. Take a look at it.
Hello, Dr. Sharma. This is Dr. Asha Parikh. I'm an internal medicine doctor practicing in Atlanta, Georgia. I have one question about the cardiac emergency room visits. We have all noticed that the emergency room visits for heart patients have gone down tremendously. But is it possible that the patients are not going to the ER because of fear of COVID-19, and the death rate at home for not getting medical attention has increased quite a bit? Now, my second question is the cardiac presentation of patients with COVID-19 in the emergency room. Thank you.
Dr. Ashaji, this is a real point. As you mentioned, that what if in this COVID era, which I mentioned, the blessing in disguise, the less heart attack, is it because the patients are dying at home and not coming to the emergency room? As I pointed out earlier in my discussion, that factor is there. It's unknown that how much it is contributing. But at the same time, I want to say that knowing that anything happened to the patients, the family will reach out to, let's say, a patient had a cardiac arrest at home. In last 5 weeks, 6 weeks, only 2 patients of mine, of the 20,000 patients, had that event. So just to say, that is definitely a contributing factor. But at the same time, our education to the public, to the patient is Don't let that happen.
Mhm.
And this is very important point, that if you are suffering from increasing symptoms, unusual manifestations, shortness of breath, more leg swelling, do not be afraid of coronavirus, because coronavirus won't kill you, but heart disease will kill. So therefore, the contribution of reluctance to come to the hospital in this era is probably contributing somewhat, but less than 10% of the of heart attacks coming to the overall contribution is less than 10%. But majority of the decline which we are seeing is from the various factors which I mentioned about the diet, air pollution, and better physical and mental well-being.
Yeah. Speaking of physical and mental well-being, Dr. Saab, in the second segment of our conversation, while you were sharing your, research study, your document that you have put together, you mentioned about the short-term goal. Of course, it's a win-win. About that people have less stress and they're able to focus more. They're able to have better outcome and less heart attacks. But then you also mentioned about long-term implications as well, because there is less work happening, less productivity happening, and their mind is less occupied. And because of that, during the conversation, you brought in many individuals are laid off. There are furloughs going on. There's so much happening that there's always a constant anxiety. Now, during that phase, what should we be doing? What should be the preparations be like?
No, the question is very real valid in terms of at present, everybody having good time mentally, physically. What will happen 2 months later when you have to go back to the work and there's still the same stress? But I think what has happened, or what will happen now, that this 2 months has changed our mindset. It will not be as crazy what it was before. And at least also, it has taught us how to relax. So I think some of those good habits I expect and I recommend to continue.
Mm-hmm.
So that to me will be now. There is the question in this is that now you go back to work, but work is less, your salary is cut in half.
Right.
People, they have been furloughed, they have been fired, they have lost their job. So those will continue to be a problematic, but at the same time, from the government point of view, whether it's the New York or the rest of the country, that really has given various options, help to these people for unemployment benefits and so on and so forth, whether those kind can be deployed in globally, let's say India or other places, need to be seen. But key is that remains unknown, but I would say that knowing that it has prepared, like you go to the war, you do various training, the same way. So these 2 months has prepared us to be good, heart and healthy. So yes, we'll be exposed to same, the food, the physical, mental stress and so, but at the same time, I expect and I recommend, I suggest, I pray that everyone will continue those good habits even once the real life starts.
Yes. Allow me to take another video question. This one we have from Shweta Rawat. Take a listen.
Hi, my name is Shweta Rawat, and my question is, up to what extent the face mask and face shield are safe from coronavirus protection in public area? And also, what extra precaution should heart patient take while wearing the mask?
Yeah. So Shwetaji, there are two questions on that. One, heart patients should take extra precaution. Now, as you know, the mandatory use of mask has not been enforced, even by CDC or by any state regulatory. They're just advised. And particularly when you are close gathering, it's very, very important that everyone wearing a mask. Now, I'm seeing now the pattern on the street, in any place you go, 80% people are wearing the mask. So that actually is a very good habit. But for the cardiac patient, it has to go beyond that. Now, there are two types of mask, which we call the simple, the surgical mask, which is here. And then the second is called N95, which is, there are various types, but one of the simple one. So what has shown that for a simple exposure, the surgical mask on the right side, or it could be any clothes, your handkerchief, anything which can cover your nose and throat and the mouth will be good enough. Now, once you are really exposed to someone who is suffering from coronavirus, and you being a healthcare, or you're coming to the hospital where there is a concern that somebody whom taking you could have the virus. So this N95 seems to give 95+% protection for the virus. So therefore, yes, extra the mask. And then if someone really, let's say you are in some doctor's office and you're more concerned that you see a sick patient nearby, so then there is additional shield. The shield mask basically covering your eyes also will be helpful. But overall, the using the surgical mask, or some the the handkerchief, or any kind of the cloth mask which is handmade are good enough. But for the true exposure for the heart patients to the potential COVID patient, you need a N95 mask, which in the past used to be the dark blue, which is very tough on the body. But then they have modified this to the much simpler variety, and that's also available. People can, we are giving to our patients to use it to further protection for the virus. And that's very important, because as I mentioned earlier, that heart patients are very susceptible, particularly elderly heart patients.
Yeah. Yeah. We'll take one more video question before we head to another break. This video question we have from Neha Patel from Massachusetts. Take a listen.
Good evening. My name is Neha Patel. I'm from Boston, Massachusetts, and I have two questions actually for you, doctor, for today. Number one question is, if someone get infected with this coronavirus, how long does usually it last in someone's body? And number two question is, if somebody is on self-quarantine mode in situation, then how would someone get to know if they have completely recovered from this virus? So those are the two questions I have, and have a wonderful evening.
So Nehaji, this is a very important question, which actually kind of changed many people's life, and that is the quarantine. And what is the duration of this virus? That how long should you self-quarantine, or if somebody is suffering from the virus, have the symptoms, have the positive, let's say COVID testing, and how long this patient should be isolated. So recommendations at present is, it is started with overall with the spread of the virus, that once you get the virus, it can spread between 3 to 5 days. And once you are infected, it can last up to 7 to 14 days. So this is where the whole 2 weeks quarantine process is started. So now more and more, knowing that the 14 days is way too long. So many centers, including, let's say, patient or our employee who has come from somewhere where they could have been exposed, and we put them on 7 days quarantine, and then you do the testing for the virus. If it is negative, even after 7 days, they're returned to work. But if you are infected, you already have a COVID positive, you had a fever, you're symptomatic, you're treated as an outpatient, and now you're recovered. So recommendation is that 14 days, particularly the 3 days if you are without fever. So let's say your temperature became normal after 7-8 days of infection, 9th, 10th, and 11th day, your temperature is normal. The 3 or 4 days after that, when the afebrile, that person is returned back to work, is okay. And this now, it can be more sophisticated. So in those cases, if you want to test again for the coronavirus, and if it is negative, then they are safe to come back. But knowing that the testing is not freely available yet, till that time, we just have to go with a recommendation that self-quarantine for 12 days, for 14 days, but can be made to 7 days if no symptoms. Second, if you have symptoms, you need to, usually it is between 11 to 14 days, but more importantly, you have to be 3 days without fever before work, come back to work.
Yeah, Dr. The idea is also to, to clear the facts and the fears and the myths related to quarantine and, what we're talking about. Speaking specifically about the duration of quarantining, or, patients who have recovered from COVID-19, the question is, after the after an individual has recovered and you're saying that one can go back to work, what are the chances of still his colleagues to catch on COVID-19 if the person has tested negative, and of course he's discharged from the hospital and has followed the protocol of staying in isolation for a few days and then resumes back to work? The mindset of the colleagues at work is still that this person was a COVID-19 patient, and there's a sense of fear to interact or to get closer, even though you're maintaining social distance, but still there's a fear factor. So what is it that you'd advise to the viewers? Secondly, the person who has recovered can get COVID-19 again also. I mean, that's again, as we're hearing the news about resurfacing, do you think it could, that person is still, at stake, or what percentage is that it could come back to that patient? Please explain us that also.
Actually, Vikasi, this is the very practical question you have asked, and then one which I had to deal with about 3 weeks ago. Just to give an example, one of my the colleague doctor who had a COVID got treated. He got the hydroxychloroquine and zithromycin combination. He was positive. He remained had fever 8-9 days. He continued to have symptoms. Then he became afebrile. We got him tested again. The test results were not back at that time. But then we had a consultation by the infectious disease doctor who said, since you have no fever, 3-4 days now passed by, you're returned back to work. So he came back. All my staff revolted. So because the point you exactly have said, that concern. So that concern at this time, we just made it empirically that you got a fever, you got infected, come back after 14 days. Mm-hmm. But we can add a science into it. One is that knowing that the test is easily available now, can be done at various centers, although it takes now 6 hours. So that person can be tested. And if that becomes COVID negative, then it's completely fine. More importantly, people are making the antibodies now. And that is where, how we develop immunity to various influenza, other rhinoviruses and so, because there is a herd immunity that you get a subclinical exposure and you make antibody. So antibody testing for corona is also available. So 2 tests. One for the antigen, means for the virus. And secondly, that do you have the immunity to the virus? That's called antibody testing. So that antibody testing are 2 types, IgM and IgG. I want both people with that. But just to say that if someone who developed the virus and developed antibody, that person is immune from the corona, then that person is not going to develop the second attack of the same coronavirus. Now, 6 months, 9 months later, we can have a different strain of mutation of the coronavirus. They may not give protection, but that we do not know. So clearly, that antibody testing is a good thing to have, those who have already been infected. But those who have been infected, I would suggest to give comfort, as you mentioned, to the colleagues, the people who are with you, whether working, not working, your friends, your family members, that if you turn negative after this time, and you should become negative, majority of people become negative, that will give the confidence to everyone. So this should continue. We should exercise options this way, and more and more we will learn about this process in coming time. But key is both antigen and antibody testings are available. There is still take some time. For antibody test is about 24 hours. For antigen testing takes about 6 hours. But all those things in next 2 weeks will change, because Abbott has been approved by the FDA, Abbott testing kit for both. Testing the antigen, which takes 6 minutes to 13 minutes. If you're positive, 6 minutes. If you're negative, it takes 13 minutes. And secondly, for antibody, it takes about 5 minutes to tell you. So this all rapid point of care testing will change our lifestyle. And actually, as you know, the US government also had approved $30 billion
yes,
to get this rapid testing available as many as center possible. Because one of the way we are going to prevent progression of this disease is that we identify people who are infected and do the quarantine and treat them properly. And therefore, the second wave which will occur. The second wave will not occur because of the people are reinfected. Second wave will occur that people who are silent or asymptomatic. And now they come back into the mass herd. So all the self-containment measures which we have exercising now, if those disappear, so they may give more infection. So that is what biggest concern is. And as far as my knowledge is, only way we can curb that is more testing.
एक आखिरी ब्रेक लेते हुए डॉक्टर साहब से ये समझना बहुत जरूरी है कि जब हार्ट पेशेंट हॉस्पिटल में कोविड-19 से अफेक्टेड होकर के आता है, यदि कोई ऐसी परिस्थिति हो जाती है, तो उस वक्त क्या प्रोटोकॉल डॉक्टर्स फॉलो कर रहे हैं, खासतौर पर डॉक्टर शर्मा क्या प्रोटोकॉल फॉलो कर रहे हैं, ये समझना भी बहुत जरूरी है, बिकॉज उससे जागरूकता और फैलेगी। और सबसे बड़ी बात, मेंटली वी विल बी स्ट्रॉन्ग दैट इट्स नथिंग टू वरी अबाउट, बट देयर इज अ सिस्टम इन प्लेस व्हाट डॉक्टर्स आर ट्राइंग टू do to treat the patients. We'll understand that from him on the other side of the break. Stay tuned and keep watching Focus Live Season 2. Welcome back. You're watching Focus Live Season 2. Ladies and gentlemen, we still happen to be in conversation with Dr. Samin Sharma from Mount Sinai Heart, New York. He's the Senior Vice President and Operation and Quality head in Mount Sinai Heart, New York. And Dr. Sharma, thanks so much for taking our time and sharing your expertise with our viewers. Just before the break, I mentioned about what's the protocol these days. If a patient is diagnosed, specifically a heart patient is diagnosed with COVID-19 and in rush is brought to the ER and you are examining that patient, what is the regime, what is the protocol that you're following?
Yep. Because this is actually the very important and the practical question, and most important is reassuring for the patient, which I want to emphasize that if any patient is suffering from acute symptoms of heart, you need to go to the hospital, because all hospitals are having adequate precautionary measures. Now, what are those? The 2 points, that if somebody having a real heart attack, which we call STEMI heart attack, if there is a chance that someone may be exposed or have a fever, may be suffering from the COVID-19. So what has come up by the recommendation is that rather than taking them to the procedure, like doing the stenting, which is the best treatment, that give a blood clot dissolving therapy, we call thrombolytic therapy. So at least treat them acutely, and if they are not tested yet, you'll have the results in 6 to 8 hours, and then you can decide what to do. But second, if someone, no risk, has not been exposed, and they come to the hospital and having a heart attack, and the test has been done and you are negative for the COVID, those patients are treated as such, what we are doing before. Take them to the cath lab and do the appropriate treatment and open the artery and put the stents. If, second point, if you are having just angina or severe angina, but not having a serious heart attack, so those patients, what is the policy have been in all the institutions, that you send for the COVID test and wait for the results, which takes 6 hours, maybe 12 hours, does not matter. But at the same time, you treat the patient by other medicines, by blood thinner, by nitroglycerin, by beta blockers and aspirin, other medicine. But then wait for the results. And then once the results come, then you treat the patient accordingly.
Can you talk a little bit about it? When and in what scenario a patient is given hydroxychloroquine? The assurance, what are the key things to take care when it comes to heart?
Yeah, so a very important, pertinent question. As a rule, there is no treatment, no proven or effective treatment for COVID-19. So that I want to say upside. Because anything which we are doing right now, excuse me, some good results, then some negative results. Despite being some negative studies of this combination of hydroxychloroquine and zithromycin, and hydroxychloroquine is 400 milligram twice a day on day 1, and then 400 milligram daily for 2 weeks, and zithromycin, because Zithromax, 500 milligram daily for 5 days, and some people are supplementing with the zinc, because all this the 100 or 200 milligram daily. So this combination seems to be, the majority of the trials have shown is beneficial. To me, actually, I say another point, those who are as a preventive measure, just hydroxychloroquine alone, 200 milligram per week for the healthcare worker who are exposed, but no symptoms, but exposed, probably is quite beneficial. And I have given to many of my healthcare colleagues, including my fellows, my son, who is an interventional cardiologist fellow, who is taking care of these patients by COVID patients in the ICU. So I have provided this as a prophylactic measure, but that is just my personal opinion. But overall, the treatment, this combination seems to be working very good. But at the same time, what is the negative? As you mentioned, that whether it's a decrease in pressure or so, what has shown that these two combinations cause some abnormality in the heart rhythm, and that we call QT prolongation. Now, what is the QT prolongation? That is a special measurement when you do electrocardiogram, and once it goes beyond like 550 milliseconds, then there is a much more chances for heart rate become irregular, develop ventricular tachycardia, and there have been many reports of that, and that actually has deterred many people to use this treatment effect or like unanimously. So what I suggest, the patient knowing that we don't have any definite treatment, what I suggest that younger patient, less than 50, no heart problem, there's no problem, you just go ahead and take these two combination. But those who take heart medicine or somebody who is more than 50, 55 years of age, do the baseline electrocardiogram and then repeat it after 5 days. So you'll be able to see if any harmful effect of this combination occurring. Once it goes beyond that 500 millisecond, this QTC prolongation, then you stop it. So key is that incorporating, don't give it empirically without careful medical the care, and you have to follow the patient and with the electrocardiogram, and then you'll have a very good results. But yes, there have been reports of this combination causing some cardiac arrest in rare cases, and we need to avoid that.
Yeah. Last video question we want to take and wrap up this conversation. We have this video question from Prakhar Ghosh from New Jersey. Take a listen.
Hello, Vikas. I hope you and your family are safe in these difficult times. Before I ask the question to Dr. Sharma, I just wanted to give my heartfelt, sincere thanks to the medical fraternity who is, fighting for our lives and are on the forefront. So big salute to them. And coming back to my questions, I've got two actually. And the first question being the statistics of people returning home safely after being, infected with the virus and turning positive, getting treated and returning home, vis-a-vis the fatalities that we see. Is that an encouraging trend? The second, rather more important question is that eventually I think we all will get infected, and the only way we can, really at an individual basis, we can fight the disease is, fortify ourselves, our immune system. So that was my real question, is that how do we really take care of ourselves and make sure that even if we do get infected, our body, our immune system is capable enough to, fight this deadly virus. Thank you.
Yeah, Prakar, this is a great question, which we have partly alluded earlier, is that patient has received, has already had the virus, has recovered from it. And what is the immunity? As I mentioned, that yes, majority of these patients will develop antibody, so they themselves are protected. But in some instead, in the early time, even if they develop immunity, they may still infect. So therefore, antigen virus can still be positive. So it has to be that virus become negative and you develop the antibody. That's the best combination. So what we are expecting is that in over next few months and time period, that lot of people have developed subclinical infection and has developed, we call herd immunity. That
Yes.
From public point of view, just like our influenza, just like any other viral illnesses, that we develop immunity. And that is what we are expecting, that more and more people who develop antibody will become immune. And the same time, the intense research on the anti-COVID vaccine is ongoing, and it looks like by September, October, we'll have some preliminary data on that vaccine. And once we get the vaccine, then I can tell you we definitely win over our COVID-19 virus.
Absolutely, and that is a very, very optimistic note to wrap up this conversation, that we are all looking for a vaccine to come, for many individuals who are losing their lives. So we of course pay our heartfelt condolences to their family, individuals who have lost their life, but at the same time, as our spiritual gurus, as our mentors, elderly people say that keep your faith and hope intact. There's always a light on the other side of the tunnel. Dr. Sharma, thank you so much for joining us in tonight's episode of Focus Live and sharing your expertise and knowledge with our viewers. Really appreciate your participation.
Thank you, Vikas, and thank you for this excellent work you're doing for the Focus Live, and thank you, TV Asia, for really educating our public and the community. Great job.
Thank you so much, sir. Ladies and gentlemen, it's a wrap. Until next episode, stay focused, stay blessed. Good night.